It's fantastic to see you again. I thought this morning I might be tired, but actually I was full of energy and feeling fantastic because I'm having been around you all weekend. Yeah, I've got so thank you all for being part of that amazing energy, which I'm really feeling charged by. And this morning I had to go to a place, Paisley, just over to the west of Glasgow, and run a community arts module, teach a community arts module, which I was able to use, show Feel and Rise that we spoke about yesterday. We're going to do a zine making workshop with the group here next year. So, and hopefully feed some of those zines into the Feel and Rise process.
I mean, if we'd known that Finn's flight was going to get cancelled at 6 a.m. this morning, we could have came along.
Yeah, great to see him. But for me, I'm already feeling, these connections that we're making are starting to kind of embed outside of that kind of room and into my thoughts and connections. So today, we originally thought we might take you around the city to different places because it is a beautiful city, especially when it's a bit drier. But given people's time schedules and things like that, we thought maybe we should try and bring the city to you. So I'm joined by my friend and colleague Joe, who is a real live community development, community health worker in the city. So I'm going to give you kind of overview of the official, if you like, line about community health in Glasgow, but in Scotland wider. And then I'm going to ask Joe to give you a bit more kind of the real lay of the land in terms of what that looks like. Because I don't know how it is across Europe, but certainly in Scotland, we tend to have what I would say is more progressive policies than England. Traditionally, we have Scottish Parliament, which is responsible for certain areas, and health is one of those areas. Some people would argue, they might present themselves as kind of left of centre. We know the centre so far to the right that these things are all kind of negotiable, but they have signed up to things like the Wellbeing Economic Alliance. So this kind of idea of decentering gross domestic product as the kind of measure of success, and having well-being as an indicator of. And this is appropriate for Scotland because Scotland still, and Glasgow in particular, still has this tag of the sick man of Europe, because our statistics would show us the thing they call the Glasgow effect was that even in similarly communities like in the Rhine Valley and all different areas across both the UK but also across Europe, where there was significant deindustrialisation. So again, Glasgow for a long time was around shipbuilding and various different kind of industrial processes. At the kind of end of the 70s into the 80s, all those kind of jobs went, and there was a really significant, high levels of unemployment, and even taking in kind of similar factors in other countries. Glasgow's health overall and health inequalities in particular are significantly worse than many of these. So there's been a lot of research, and there's a colleague from, I think, called the Glasgow Centre for Population Health, who have spent how many years, Tony? About 15, 20 years?
Yeah.
Studying that, and have produced a lot of reports around the Glasgow effect. So that Centre for Population Health kind of bridged the gap between the kind of medical model and looking at people's levels of prescribing for mental health difficulties, etc., looking at various levels of indicators of ill health, and often a more community-focused approaches to this. So it might be, studies on impact of using the arts within promoting health, etc. And agency, that kind of sense of people feeling that they had some kind of influence over the decision making, and so this kind of idea of listening and having what's the lived experience. So if you've still got one of the worst levels of addiction deaths across Europe. So whether that means we have more people using drugs, but we certainly have more people dying from addiction and overdose than in other European countries. So part of the process of addressing these kind of issues is start to listen to people who have got lived experience of that, and then hopefully give them influence within policy to say, are we creating policies which actually listen to people, and do we put people at the centre? And that is true in a number of areas. One area is care experienced people, so young people who have been taken away from their families or don't have families, or for whatever reason have to be cared for by the government. Essentially, they come into the care of the government. They have significantly worse health outcomes, educational outcomes, employment outcomes, you name it. They're just like one of the most disadvantaged groups in our society. And they came up with this policy called the Promise, which was a promise from society essentially to those young people experience that there would be action taken to address that. And so that for me is one of the more progressive pieces of policy. But you've got to play this out against a backdrop of austerity. So what is happening now is when they go back to evaluate, have we delivered on the promise? People say the principles were good, the process was good, but the resources have not been there to make good on the promises. And it seems to be that kind of churn where even when you get a positive policy environment, it doesn't deliver on it. So an organisation which has been running for about 20 plus years is called the Community Health Exchange. And this goes back, the concept of community health projects in Glasgow in particular, go back into the kind of 80s and 90s, and often it was money from Europe through urban development funding that would come in, and they would use this funding from Europe to set up projects. The Healthy Cities kind of project was one of those, and often the community development models. Now, when I say community development, what does that mean to folks? Is that something that would be, if I say community development, what would that look like in Italy? Because I know that the World Bank, for example, use models of community development. But, again, this is a kind of performative, form of community development, which actually kind of says, well, it's over to you. It's over to you guys. You kind of sort it out. But we put parameters around you so much that you don't really have any power in this. But we have, we give you the sense. So when we talk about community development in Scotland, it's actually it's kind of where we have a degree at this university in community development. We have a master's degree in community development, and this is all the work around the work of Paolo Freire, about Alinsky, all these kind of bell hooks. So a kind of theory-based critical pedagogy about how a community development approach is really about looking at systemic issues of oppression. But that word community development has been painted across so many different things that in many cases it's lost its connection to its criticality. But this organisation, the Community Health Exchange, its sort of mother organisation is an organisation called the Scottish Community Development. I always forget the third bit. Scottish Community Development Council. What is it? Centre. Centre. Thank you very much. Scottish Community Development Centre. So this concept of community development is something which is it's everywhere in Scotland. The unfortunate thing is that we, as People Health Movement Scotland, used to have the woman who was responsible for kind of the chair of this, but now they don't come to our meetings. They don't come to our, and they have, an annual conference, and then they have various different organisations, but still there's not been the dialogue between the different organisations. We talk about it, being siloed into, this is our group, this is your group, we're over here. And within the People's Health Movement Scotland, we are trying to address those silos and bring people together. But this is an example of the community health exchange will, give definition to these things, like a definition of what community health is, community-led health is, and you can see these different different organisations. So this would be the Edinburgh, so the capital city Edinburgh Community Health Forum. This is the Alliance, which is really the voice, the organisation that's the voice of lived experience, if you like. And we were meant to have a representative of the Alliance along to our meeting, but they weren't able to make it. This is the Scottish Community Development Centre, so that's the mother organisation. And this is Voluntary Health Scotland. So there's a policy around recognising volunteering and recognising that a lot of people give care on a voluntary basis. That so much care, and it's obviously incredibly gendered as well. But the issue is that volunteering levels in Scotland are dropping very rapidly. Since sort of post-COVID, they've really kind of tailed off, and maybe that's a lot to do with standard cost of living, all these kind of rising costs. People are feeling more and more under pressure. So, if I can get this to work. So this organisation is funded, well, I can suppose I'll show you the actual title. So, so this is supporting network. I realise you can't read this, apologies. This support networking between people and organisations working in community-led health and related sectors. Now, there are other organisations that do this as well. What's the one that Kingsway is part of? The one that your dad's part of?
Oh yeah, Scottish Community for Health and Wellbeing.
Yeah. So there again, there's more fragmentation at another level below that, and there are projects that are more kind of in rural settings, in health projects which have their own networks. But there's a commonality with all these things in terms of their approaches. This organisation will produce research, do consultation, which smaller organisations obviously don't have the kind of resources to do. So you can see here. So the concept is, how do you influence policy and practice? And they've got these strategies. So there's a constant discussion around how do we know the policies that are there are not having, having the effect they're meant to have. The inequality rates keep going, the poverty rates keep going. So we kind of get into this churn of, oh well, that policy didn't work, what do we do? And I think that's one of the reasons that we are into the People's Health Movement, is because we realise it's not the policies, it's the system. We're working in a system which is toxic. So to constantly keep things about moving, like the deck chairs, that kind of thing, moving the deck chairs on the Titanic, we are not actually changing anything substantial. Means that we just keep going in the same direction. We keep getting the poor negative outcomes. But people could be very busy doing these type of things, and I don't know if you have those kind of I'm not saying they're a bad organisation. I'm just saying there is a culture of reporting, researching, projects. Do a project. Oh yeah, working with music and arts really helps people mental health. That's fantastic. Let's go. And yet, again, there'll be more cuts and more cuts. Yeah, Tony.
I was just saying, is it worth mentioning the health issues in the community?
Oh yeah.
Part of that is one thing, and then I guess also something came up yesterday, and some of the discussions was about. I guess some people in People's Health Movement and other movements are very against using any kind of government funding. And the likes of checks and SCDC do have some element of, I think, Public Health Scotland.
Yeah.
Partly co-fund some of the work that they're doing. Well.
Yeah, so that is so one of the critiques, if you like, of these kind of organisations is that a substantial amount of their funding comes from Scottish Government. So it becomes a very difficult place to then be critical of the people who fund you. Because especially in an environment where funding is reduced and reduced and reduced, there is the pressure on them to not be, not go into too critical space. This thing that Tony is talking about, which is a good, I would say, a very good example of good practice and linked to our popular education discussion we were having yesterday, is a thing called health issues in the community. So this is a long established, I think 20 years they've been doing this, and it's basically a community development model of learning. So I'll give you an example. What happens with this is like a six-week course, I think it is, and they'll recruit people from the communities. The part of that is to decide what priority, what is your health priority, and it's health in the broadest sense. So to give you an example, so what happens is you work on a kind of project base, you start to kind of connect with theory and have these discussions, and then you do a presentation. So when I went to 10 years ago, was by a woman called Leanne, who now runs a community health project in Drumchapel, which is out in the west of the city, called Drumchapel Life. And it was all about suicide. And this was because she had lived experience of, finding one of her family who had completed suicide, realised that the area that she lived in was a hugely high area. It's right in the west of the city, and it's where the Antonine Wall, came down, and there's a local nature reserve. So on one level, it looks quite idyllic, and the other, it's an area where there's for decades and decades of poverty and ill health. So her presentation, she really likes poetry, so she wrote a poem called Earth Angels, which really kind of captured the feeling. But she'd also gone to various different areas in like the train station and places where people had gone and completed suicide. And it's an example of how, and now this woman works now professionally. So it went from somebody who was experiencing poor mental health, experiencing a lot of the impacts that people in that broader community were doing. She went on to lead a research programme with a thing called Together for Change, which was a group of people with additional learning needs, so learning difficulties, but who she's worked with and has used the arts and all sorts of different approaches to give them a voice and a really genuine, authentic voice. Then cut our funding. Okay, so Leanne I invited her to come to talk to you today. She's on a holiday. She really needs holiday. But she is a very authentic, grounded person who, so I'll give you an example. Last time I spoke to her, which was a couple of weeks ago, we had a family from Iran, I believe it was, that had their windows smashed in, so people had thrown bricks through the windows in Drumchapel. Now, whether it was about racism, when it was a mistake, sometimes there's quite a lot of, there can be aggression around drug activity or, fallings out in the community. So there was a little bit of, unclarity about whether this family was particularly targeted or not. But she and a number of the people in the area had come together to show solidarity with that family, to come around them, so that real sense of kind of, this is not our community, you are being victimised in here, we care for you, we will look after you. So she's that kind of person. She's somebody who's been trying to influence Scottish government, but doesn't take fools lightly. Do you know what I mean? She just, and obviously whenever you've got funding control over people like that, if they're not saying the things you want to hear, then it's easy just to cast them adrift. So that's just kind of one of the realities. But this, as I say, that's an example of how you can take a community development model of learning and actually grow people's capacity, grow people's agency. I bring in Joe this time because I think you've got other examples of that kind of work that you do, and in fact your whole model that you've kind of developed. Do you want the website up there? Was that going to be helpful? Or
No, but I'll go on.
right, come on. I like those reports. They're very colourful.
Yeah, because to add, so like the HIC thing is about peer-led tutors in particular. So the people who teach about health inequalities on that are members of the community. They're not like researchers or not academics that come in. They get that sort of training. So the idea is once you've been on the course, you can go again on a sort of peer development course and you can then become the tutor that goes forward. So again, it has this kind of organic life beyond just the stuff.